And autoimmune disease is a condition in which the human immune system mistakenly attacks the body. Autoimmune diseases are some of the most difficult to recognize. Medical experts in Nigeria at the 4th annual Cleaner Lancet Laboratory Sensitization Program now want government to subsidize drugs for treatment and push for more local research. There's more in this report.
Women have a higher probability of developing autoimmune diseases than men. Autoimmune disease is a medical condition where the human immune system mistakes parts of the body like the skin as foreign. It releases proteins called autoantibodies that attack healthy cells. Some common examples of the disease include rheumatoid arthritis, psoriasis, systemic lupus erythematosus.
There's non-organ specific, which are multi-systemic, and this include conditions like rheumatoid arthritis, include conditions like systemic lupus erythematosus or lupus, scleroderma. It was something we call antiphospholipid syndrome. But then you have the organ-specific one, which would include things like, for instance, Hashimoto's thyroiditis, which is affecting the thyroid gland.
The American Autoimmune-Related Disease Association estimates that the cost of treatment in the U.S. alone is more than $500 billion annually. Although there is little statistics on the cost implication in Nigeria, medical practitioners in this gathering acknowledge the increasing burden of management of autoimmune and chronic inflammatory diseases in Nigeria.
We think it's very important for us to ensure that our clinicians have this interface so that they look beyond whatever they might be thinking about to include these conditions as well. And the more important one is the advent of having an autoimmune aspect for diabetes mellitus, especially type 2.
With Nigeria's out-of-pocket rate for healthcare services pegged at 70% and more than 90% of Nigerians not insured under the National Health Insurance Scheme, these doctors call on government to work on subsidies for drugs in the management of autoimmune diseases.
Some of the drugs are within reach of individuals. Outside this climb, the biologic agents are mainly the ones that are subsidized because those drugs are really quite expensive. It will also be nice if our government is able to subsidize the biologic agent.
One of the main topics was also the role of autoimmunity in type 2 diabetes and the need for standardization of testing in this regard.
Because that's the only true way that you would be able to use a measurement that you get and be able to truly understand what that measurement means, both in regards to management of the patient.
Autoimmune diseases are some of the most difficult to recognize. The consensus here is that getting the correct diagnosis may be difficult in the beginning stages, but it is imperative as the inability to quickly identify an autoimmune disease can take a serious toll on a patient.